On behalf of MSF and all of my colleagues, I warmly welcome you. Thank you so much for coming. As you know, the invitation, we would like to talk to you about South Sudan. It has been in the news because of the war, because of the violence, because of the regional dynamics and all this stuff. So it's an opportunity for us to speak to you about it. So the rundown will be that we will request our spokesperson that I will shortly introduce. And then we will open the Q&A session later on for like half an hour. And towards the end, if you want to interview one of the spokesperson, we'll be happy to give you more information. I will start by introducing my spokesperson. On your extreme right, I have Dr. Bakri Abu Bakr, who's operations manager for MSF. Bakri has 20 years of work in humanitarian sector. He's been following and working, especially Eastern Africa region for last 10 years. And being himself from the region, he has a very close eye on the changing context and evolving humanitarian situation in the region. Thank you so much, Bakri. With her, we have Helen Widget. Helen works in the Humanitarian Affairs Department for MSF. She's following Horn of Africa for past 8 years, but beyond that, within the region and outside, she has been involved in multiple emergency response and has a very close eye on the situation. And on my left, we have Abdullah Hussain, who is the head of operations for MSF. Abdullah is also a seasoned experienced humanitarian worker, working in Africa and Middle East for the last 17 years, and he specializes in emergency response. I am very thankful for you all to be here. Without further ado, I will request, we will start with Bakri. I request you, Bakri, to give us overview about the situation, how we are seeing in South Sudan, and then we take it from there.
So good morning, everyone, and welcome to MSF. It's not an easy topic to talk about the crisis, the different crises that we have in East Africa, unfortunately, but South Sudan is a major one of them. And as you know, since February 2025, the country has experienced one of its worst surge in violence since 2018 peace agreement and since the end of the civil war. The clashes between the government forces and the armed youth known as the White Army started in Upper Nile State primarily. But over the past few weeks, unfortunately, it spread over different locations in the greater Upper Nile States and also in Equatorias as well. So states including Jonglei, Unity, Western and Central Equatoria have all been affected by the conflict. So we are talking about a major conflict that's taking place over multiple fronts and multiple locations in the country, which is something definitely has and will continue to have huge impact on the population. So today, as we speak, the government and opposition forces fighting actively in these different locations. According to the United Nations, these clashes and the aerial bombardment have killed more than 180 people and injured more than 250. Which seems a modest number given the scope and the scale and the locations of the conflict. But unfortunately, we can't verify more than what we got, mainly because of the lack of access of humanitarian workers to many of these active conflict areas. The major crisis is the displacement. So as we speak, we talk about more than 60,000 population have been reported to have been displaced in Upper Nile State. As you follow the conflict, so the conflict started in Nasir, moved to Lang, and then it went through all the way to the border along Sobat corridor, but also in other places in Fangat and in other places. So in Upper Nile State, we are talking mainly about more than 60,000 population have been displaced. More than 50,000 in Jonglei State has been displaced, and a couple of thousands, like around 20 to 30,000, have fled to neighboring Ethiopia. So they have been pushed while the operations the military operations were progressing, they have been pushed towards the Ethiopian border. So many of them have crossed to Ethiopia, especially in the area of Buri Bay, which is a border town between South Sudan and Ethiopia, but also in different other crossing points along the border with Ethiopia. So this scale of conflict doesn't stop only at the war wounded, the people who were killed, and the people who were displaced, but we are talking about many people who have been affected in different ways. This displacement happens at multiple times, and so many people experience multiple displacement into different locations. They have left everything behind and moved on. So they are starting afresh each time they are displaced. Our teams on ground have witnessed and seen entire towns and villages being abandoned by the population and people forced to leave everything behind. We are talking about hospitals, health facilities, and community facilities have been abandoned as well from their staff because of the conflict. So we are talking about pregnant women who can't follow up their pregnancies anymore. We are talking about children who can't get their vaccinations. We are talking about HIV and TB patients who can't get their medications anymore, and we lost the follow-up with them. So this a major consequence of the conflict, which might not seem these consequences immediately or the full impact immediately, it will appear only by time. In other locations where we are still working, we received people who had to cross long distance walking to reach a facility where they can receive treatment, including pregnant women, including sick children, including also old people who are seeking healthcare. All this happening with South Sudan humanitarian health system already struggling to meet the needs of its own populations. There is growing stress with the displacement from neighboring Sudan. As you know, the war in Sudan continues. Since the start of the war in April 2023, we're talking about more than 1 million refugees, Sudanese refugees, and South Sudanese returnees who come back, who cross to South Sudan. Most of these resided in Upper Nile State, in Brink County, in areas and makeshift camps around the big towns like Malakal, like Fangak, in Jonglei State, and many other small towns as well. So this added more pressure on the already struggling South Sudanese health system. And this is still continuing with the continuance of war in Sudan. South Sudan and Sudan enjoyed a very strong relationships and ties economically, socially, and politically for quite a long time. And all this has been impacted. The oil pipelines which transmit the South Sudanese oil to Sudan and the oil reserves, the refineries in Port Sudan have been bombed recently, and that put more pressure on the economic situation of South Sudan as well. So we are risking having a collapsed health system in the country, in South Sudan, with the ongoing developments in the country and also with the ongoing wars in Sudan. Also, the situation in Democratic Republic of Congo to the west is adding more pressure on the country. And also, we cannot ignore the recent developments in Ethiopia as well. So all these regional conflicts impact and compound the situation in South Sudan. Since the independence in 2011, the country has already struggled with the weak infrastructures, not only in the health sector, but also in other sectors. There's limited healthcare. Half of the health facilities were non-functional when the war started, and that has increased when the war started. Just to give you a visual picture, MSF works in 6 states. We're having around 15 hospitals in different parts of the country. And when we talk about hospital, we talk about secondary healthcare and also trauma cases, and surgical care, in addition to maternal care and therapeutic feeding centers. In addition to more than 30 primary healthcare centers in the different parts where we work. When the war started, especially in Upper Nile State, we've been impacted, and we had and we still have limited access to our outreach activities. To give you an example, in Ulan County, we had around 13 decentralized models of care. It's just another name for community posts and community health activities. Since the start of the war, we couldn't reach to these places. Luckily enough, before the start of the war in March, we managed to equip and to supply most of these facilities with the enough drugs and medications, especially for malaria before the start of the rainy season, and also with cholera supplies as well. In places like Malakal, where we work in 3 axes, until now we couldn't manage to go out of Malakal town to reach to these places, so we've been cut off from the population. The same thing in other parts of the country due to the insecurity, like for example in Yei in central Equatoria. I'm not going to talk about the impact or the attacks on health facilities and humanitarian workers. My colleagues will talk about this, but I just wanted to let you know that MSF has been impacted a lot with the situation. Our patients are suffering a lot because of the lack of access, and also our staff. We have staff from different ethnicities, from different locations, from different parts of the countries, and they have been impacted by the dynamics of the conflict as well. So that managed to, or that unfortunately led to reduction in our access to the population, and we are trying to reach out to the population as much as we can as we speak today. So this is just a brief picture on what's happening in Upper Nile State and in other parts of the country, and the impact on the population, the impact on our patients, and definitely the impact on MSF as well. I will let my colleagues to talk more about other aspects of the conflict and how it impacted the population as well. Thank you so much.
You briefly touched on the impact on the patient and MSF, so I would request Abdullah to shed more light on what our teams are saying on it.
Okay. Thank you, Nasir. Thank you, Bakri, for painting a very clear picture of the situation in South Sudan. I would like to build on what Bakri was explaining and focus on the impact on the health facilities, medical personnel, and civilian population. As you know, MSF, we are quite experienced in working conflict zones. South Sudan is not the only place where we face attacks on our health facilities, but what we see in South Sudan is a change of the situation. We see a rise of attacks on healthcare facilities, medical personnel, civilian population. According to the UN, there are 8 facilities that are struck or targeted since the beginning of this year. We think that's an underestimation because the number that we know is a lot more than that. For example, in January, 2 boats of MSF were using the Nasir in the Nasir area, the River Nile, and they were transferring supplies to a health facility supported by MSF. They were targeted well back to the facility. The staff had to jump into the river for safety. One of them was wounded. That was one of the first incidents that we were suffering in the beginning of the conflict. In April, the only hospital we had in Ulan, which was in place around 5 years, was knocked off after it has been looted completely, and the hospital was forced to shut down. That hospital was serving 150,000 population. That's a closed catchment, but people come from many areas due to the situation that Bakri was explaining, that access to healthcare is very limited. So only facility in that county was that hospital and the surrounding area. And on the 3rd of May, we had also the tragic incident that one of our hospitals was also targeted. Our medical warehouse was destroyed. Two caretakers and one patient were wounded. 4 of our staff were also wounded, and also civilian population in the town. And now the total number of people wounded are 27, as we know. Were also wounded in that same incident. This hospital, again, was serving for a population of over 100,000, but that's only the close catchment. And then all the counts around that area of Olfangar, people were also seeking care, at least secondary care, in that health facility. It was a tragic incident. You can imagine a hospital full of patients, 4 a.m. in the morning, staff on shift, and there is a plane, a gunship that arrives, opens fire on the hospital and the surrounding. And the staff that were there and targeted had to, again, care for wounded people that were coming from the town, that were wounded in the town, the civilians that were wounded. So today we had that instance of hospitals. There was also another health facility close to Ulang, in Ulang area, where broad daylight, it was also struck. One of the watchmen and the civilians had to take refuge inside the facility, and then the facility was struck. They were wounded. MSF had to care for them in the hospital. Those are the examples of a deliberate target of medical facilities that is well known. Our presence in these areas are well known. We are well identified normally. We're in constant communication with warring parties to respect the safety of our personnel and patients. And just to add one point is that today, those 2 hospitals that I mentioned, there is a 250,000 people, that's what we know, 250,000 people deprived of access to medical care. And of course, that means displacement, and what Bakri was explaining, that not only they are deprived of care, but they are also displaced, wounded. So that's the situation we are in this area. I wanted to highlight a few things about the concerns we have. So the challenges we face today are the difficulties to assess the needs of the displaced people because of the movement of people, of the successive movements that the colleague was talking about. It's very difficult for us to know the needs of these people and to accurately respond to it. We have a problem also for the care for the wounded. If the health facilities become a target, it deprives the capacity of the medical personnel to go too close to the front line, to collect the patients, to care for them, and send. For you to know the hospitals that we have in these areas, first, we stabilize the patient, the wounded patients. We send them by helicopters and planes to another hospital. The closest hospital is another corner of the country in Akobo, and that's where another organization cares for this wounded. So logistically, it's very complicated. And when those staff are not feeling safe in the facilities where patients are first coming, it becomes a difficult exercise. So for us today, the main concern is the safety of hospitals, medical workers, of the frontline health workers that are trying to care for those patients. And of course, what we are requesting is we condemn all the facilities that were targeted. We condemn this and not sparing the health workers and also generally the civilian population. And we request to all the parties, whether the government forces or the opposition, to respect the medical facilities, to respect people who are caring for the wounded, and also to give access, because it's also another challenge we have is to facilitate the access of the humanitarian workers in general, or especially the medical personnel. So for me, that's what I wanted to add. What Bakri was presenting.
Thank you very much, Abdullah. It's definitely very concerning to have hospitals attacked. I will request Khaled to give more information. Their hospital being closed, but you say that half of the health facilities are already closed in South Sudan. So can you shed more light on the humanitarian situation and how it's impacting in the talks around the funding cuts and all this stuff?
Morning, everyone. So yeah, the conflict in South Sudan is coming at a time when humanitarian funding is also shrinking. And as colleagues have explained, the operating environment is becoming more complex. So since the beginning of the year, there's been significant donor cuts to South Sudan, like most notably the reduction in US funding. And this is concerning because the capacity now for humanitarian organizations to respond to this worsening crisis is severely compromised. The health system in South Sudan is heavily reliant on external support. So South Sudan government spends around 1.3% of its budget on health, and 80% of health services are run by non-governmental organizations. And even before this increase in conflict, health and humanitarian needs were increasing. And also the humanitarian response was already under-resourced and already struggling. And we saw that in the cholera response last year. So when the current cholera outbreak started towards the end of last year, before this rise in insecurity and before the kind of most severe cuts, health and humanitarian organizations were already struggling to mount a timely response. They lacked supplies, they lacked personnel to be able to respond in all areas of need. There were also significant gaps already in the health system. So Malakal Teaching Hospital, for instance, which is the main referral hospital for the whole of Upper Nile State, that has lacked any capacity to carry out surgeries since June last year. So even before this deterioration in security and the kind of access constraints that colleagues have described, there were already...
If you can speak a bit louder.
Yeah, sure.
I'm very sorry.
No, but just to say, so yeah, the example of Malakal Teaching Hospital, which is the main referral hospital for Upper Nile State. So there's been no surgical capacity since June last year before this fighting. So women in need of cesarean sections, for instance, had severely compromised access to healthcare even before this fighting. So now we have a kind of further deterioration in the context with the increased insecurity, the access constraints, and these funding cuts. And we're very concerned about the lack of capacity for organizations to be able to respond. And on the funding cuts, it's hard to fully assess the impact at this stage because it's quite fluid. But any reduction in donor funding is going to have an impact in South Sudan, given how reliant basic services are. And MSF, we don't take US government funding ourselves, but in almost all of the areas that we're working, we've seen some form of reduction in health and nutrition services. So either that is NGOs withdrawing from health facilities, or scaling down operating hours that facilities are open, or mobile clinics reducing presence, or even areas that they cover. In Renk, for example, where most of the returnees and refugees from Sudan are passing, we've seen a big scale down in resources in the last few months, with health and nutrition services closing, water and sanitation services also stopping, and onward transportation for returnees now suspended. So in this context, we're concerned that already there are gaps in the ability to meet long-standing needs in South Sudan, and these additional needs from the crisis are even harder to respond to. And now is not the time to reduce services in South Sudan. And what we actually need is an operational scale-up. But what that requires is a shift in mindset to prioritize emergency response, sustain funding to make that happen. And it also requires guarantees from armed teachers that we have this ability to be able to carry out health and humanitarian work.
Thank you very much, Alan. But we talked about the situation, how it's evolving. We talked about the attacks on hospital, and it's all happening amidst of funding cuts. And as we all know that South Sudan is moving towards, the virus is spreading. We are moving towards rainy season. There is always a risk of flooding in South Sudan. So it is giving a very grim picture, which MSF is really concerned about. Before I open the floor for question, I'm very lucky to have introduced Zakaria Mawatia, who is our head of mission based in Juba, and we're lucky to have him around Operation Islet. And if you have any question from Zakaria, and if you have any question from one of the spokesperson here, feel free. If you have, like I said, if you want to have a question to a specific person, ask that, or if you have a general question, I could direct it to the relevant person. So let's go about it. If any questions, raise your hand, and we can go from that. We'll start from you. Yes.
Yeah. My name is Fred Oloshi of the East African. I just want to ask any of the panelists who can answer. What what is the general structure, security structure for MSF in war zones? And currently, how is it effective?
The general security structure within MSF.
Security of facilities and personnel. But what is the general structure in war zones, and is it working in South Sudan?
So we are a humanitarian organization. We are not specialized in security, but we do effective security management to keep our staff and our patients safe. Generally speaking, we don't have a separate security structure. It's embedded in our operations structure. So our heads of missions, our project coordinators are responsible of engaging with the different parties, whether they are political parties or armed actors, including non-governmental armed actors or government armies. We do active engagement, and we are in continuous engagement with all these parties in order to ensure the effective access of our staff to the population and also to keep our staff safe. And these are standard procedures, are done everywhere. It varies according to the level of insecurity or whether we are in an active conflict area or in a front lines. So it varies from one place to the other. But we don't have specific or exclusive security management apparatuses. We are a humanitarian organization. We rely on our humanitarian activities. We rely on our presence among the population. We serve the population, and we think that should be enough for everyone to know our charters, our principles, and our humanitarian charter. So that's all what I can tell you about our security management, our security presence.
Thank you, Fredo.
Hi, I'm Catherine Collins, Washington Post. And I'm curious, what has the South Sudanese government said about these attacks on your personnel, the hospitals? When you talk to them, what do they say?
As usual, we are in contact with these actors, in not only the government of South Sudan, but the opposition groups and all the actors that are present in that area, in the different areas in the country, but especially the areas affected by the conflict. We are still confirming regarding for example, the last incident in the hospital in Fangak. We're in communication with them to collect their version of the story. What we know from our side is that the air power there's only one actor that has, and its allies, air power is the government of South Sudan, and we're trying to seek explanation from them what truly happened in that incident. For the other incidents, of course, we are also gathering evidence, information. So I don't know, Bakri, if you have anything to add.
That's the same way we are in continuous engagement with the different parties in the areas where these incidents happen. So, for example, for the boat, we communicated with all the armed groups and in the area. Unfortunately, that incident happened in March. Until now, we didn't get any explanation from any party. We rely on the continuous engagement in order to achieve progress in understanding what happened, and also to ensure that such incidents won't happen in the future.
Just as a follow-up, specifically, have you been asking yourself, why would somebody specifically target medical personnel? What is the objective? What is it that they want to achieve? What message are they passing?
Unfortunately, I can't give you an explanation. These explanations, I think, should come from from those who did this. Actually, which we don't know who. We don't have confirmations on that. But what I can tell you, in the recent years, we've seen a significant increase in attacks on health facilities in active wars, not only in the region, but also in other places. MSF has experienced many attacks either on our staff or in our hospitals in different parts of the world. This is part of our job, and also part of our job is to engage with the different actors and the different parties, first to make sure that they understand what we do there, and to make sure that such incidents don't happen in the future. This is very important for us to continue our work. And unfortunately, in several parts of the world, we had to halt our activities. We had to withdraw our teams and to suspend our activities. South Sudan is not an exclusion to that, unfortunately.
Thank you, Bakri. Amu?
Amu Kanapali from Reuters. I know you're investigating the attack in Orfangak on the facility and the surrounding town. Do you have a sense of when you might release the results of that investigation?
We don't have a timeline of when we will release the findings. We are definitely doing our own internal fact finding to establish the facts of how the incident unfolded. We're also talking to the government of South Sudan, but also the opposition, to understand why the question the colleague asked about why the hospital was targeted. The hospital was well identified. It had basically all the requirements of a hospital in a war zone. So pretty much the identification of MSF. We give the coordinates of this hospital, of all our facilities in South Sudan, to the parts that could harm us. So they know where we operate. We're in constant communication. And historically, this hospital was 10 years in place. So it's not like a hospital that was opened yesterday. So the actors would confuse this presence. So basically, the answer is that we don't have a timeline, but we hope to get the facts of what exactly happened.
If I can add, the official position we have so far on social media is no position. This is what we read from them when they were asked about the attacks, especially the one with the air power. We also have people online, so I will take a question from people online. Johnson, who's online? I saw a hand. Do we have the mic open for online? Yep. Do we have a question online? Please unmute yourself and speak. That's how it works. Well, I don't know if there was let's continue for the room. Is there any other question? Please raise your hand and we can. We had somebody at the back. Yes, sir.
Name is Hillary from National Media. Just wondering, the bombings from last week. Do you have any plans of reopening, or and did you lose any significant staff? And from January to now, how many staff have you lost during these bombings, and what has been going on?
You can tell about
yes. Regarding the hospital, so basically we had the incident. The population of the town fled. They went to nearby towns, and our team went with them with the wounded at that time. So we evacuated the wounded with the population. We referred the patients, and at the moment, what we maintain is a basic minimum facility in Toj, where we care for the wounded that are coming from the front line. It's important to highlight that until now, we are receiving wounded and trying to refer with our capacity disrupted, in the sense of the hospital being forced to shut down. And in terms of our staff that were affected, for Orfangak, there are 4 MSF staff that were wounded. 2 of them inside the hospital by shrapnels, I mean the fragments that were arriving because of the explosion. And there are 2 of them that were wounded because of the bombing of the town, because the market of the town has also been bombed. It's important to highlight that one of the first instances that the accounts of our staff was our national staff of South Sudanese that were there. The days that followed the incident, they were complaining about food because the only place for food was hit. Basically, it was the main market of the area. So basically, to answer your question, our staff 4 at least, and I led the Bakri to complete for Ulanga also, that was our hospital affected. And their staff are fine. We're caring for them, as well as the patients that were wounded. And the activities at the moment, there's no decision to MSF to leave the place. And that's the reason why the challenge we have is that in a place where the people are displaced, there is a wounded arriving. We want to care for this population, but we need a guarantee of security that there is no further attacks on the facilities that are remaining on our staff.
Yep. Just to continue for Ulang Hospital incident, which was the looting. Fortunately, no one of our staff was harmed. At the time of the incident, we had around 167 staff working between the hospital and the outreach activities. It seemed that the target was not the staff themselves, but the commodities inside the facility. In the boat incident that happened in early March, we have 1 staff wounded. But here we are talking about the physical impact, right? But I think we need to talk about the psychological impact and the mental health of our staff who's been working on providing services for the population in the middle of this crisis. This is a very important aspect that we pay attention to. And I think we need to quantify this if there is a way of quantifying it. Unfortunately, it's almost impossible to quantify, unlike the physical war wounded. Another important aspect is that during these attacks, we lost significant amount of medical supplies, whether in Ulang Hospital, whether it's in Fangak Hospital. So in Ulang, we lost almost the stocks of 9 months of medical supplies, including food, therapeutic food, for 200,000 patients. In Fangak, we lost almost the stocks of 6 months, including surgical supplies and therapeutic food supplies for around 150,000 people. This is huge amount of supplies. So now our capacity has been significantly reduced in both locations to treat the population. And that's one of the consequences, that we might not be able to see the full impact immediately, but it will definitely appear by time. So now we are trying as much as possible to restore and to restock our hospitals. We are trying to resume our activities in the outreach sites. Just to give you an example, in Malakal, we stopped our outreach activities in 3 axes: the Baliet axis, Akoka axis, and the Canal axis. So we are talking approximately about 200,000 people who were being served by our outreach activities. All this is cut now. Good news is that in Baliet access, we hear that some of our colleagues from some of the UN agencies, they managed to do one-shot intervention in that access. And we are hoping that we, as MSF, could resume our activities as soon as possible to continue providing healthcare for this population. Just as an impact, also to understand the impact of this conflict, along Sobat corridor from the Ethiopian border, if we take Burubay town as a landmark with the border with Ethiopia, up to Malakal, we lost all our secondary healthcare facilities. There was only one healthcare facility, it's Ulang Hospital. Because of the looting, we had to suspend the activities there. We had to withdraw our team. So along the Sobat corridor, there is no secondary healthcare in that area. This is huge in terms of medical care. In Malakal, as Helen mentioned, before the war started, and due to the aid cuts, we lost the surgical capacity in Malakal Teaching Hospital. So now in a very wide area, there is no surgical care in Malakal County and the surroundings. So what we are trying to do now is to build this surgical capacity in the town. Of course, there is very limited surgical capacity in the POC of Malakal, which is the population, the protection of civilian camps. So there is a very limited capacity. We are lucky to have that capacity, but the access is still very limited. The access to Malakal town from outside is still very limited due to the active conflict in different parts of the county. So we are afraid that there are so many people in the bushes, in the small villages, in the small towns around, can't have access to healthcare, and they're completely cut off because either they can't come or we can't go to them. So this is very serious situation. And let me take this opportunity through you to send a message to all the warring parties that healthcare facilities need to be respected, humanitarian actors need to be respected, and free access need to be ensured to all these places and to all population in need, regardless the ethnicities, regardless where they stand in this conflict. This is a very important message that we would like to send to all parties.
Thank you, Bakri. Just to put that distance into perspective, from the border to Malakal, it's over 200 kilometers.
Yes.
And if you travel by boat, it's at least 10 to 12 hours. So this is the area where there's no medical facilities in between, and Ulang was the only one. Any more questions?
I hope you don't mind. This question goes to Helen. You touched slightly about the funding aid cut. Would you give us a brief overview of MSF's funding, source of funding, and how much generally you need in South Sudan annually?
So yeah, for MSF,
Funding.
our funding is mainly from
Funding,
yeah.
and how much do you need in South Sudan annually?
So for MSF, most of our funding comes from private donations and not from governments. And so we don't take money from the US government, which means the kind of reflections on the severe donor cuts for South Sudan are mainly affecting other organizations. For us, our budget, we have one of the largest programs in South Sudan, like globally, with a budget of over 100 million in the country, working in 12 different 14 different projects, in 6 different areas and 2 administrative states. So we have a big presence mainly in hospitals, so in secondary healthcare across the country. But that said, what we see from these funding cuts is the reduction in other services, other actors who are doing health and nutrition services, water and sanitation, and that will also have an impact on the populations that we serve, because, reduction in primary healthcare will put additional strain on already overstretched secondary healthcare facilities, for example.
It's actually saying the budget is for this year is 107 million euros. And like you said, it's 14 projects, but it's not 14 projects because each project supports multiple facilities, be it one major hospital or different primary healthcare centers. For example, in Ulang, like Bakri said, the hospital itself, but there were 13 other sites within Ulang project that were being supported. You wanted to ask a question? Or
Yes, sorry, I just wanted to know, you said that there had been attacks on 8 facilities. Were those all health facilities or were they different kinds of facilities?
Yes, health facilities. That's according to the UN. But of course, the incidents are happening. That was like 2 weeks ago. Yeah, basically every week there is incidents that are happening. So we think it's an underestimation for sure.
Do you have a list of, the more than the 8?
We have facilities in the areas that we work. Yes, we have the areas that we are present here.
Nice.
Yeah, but at least there are attacks in January that was on healthcare, then the looting. Then we saw something in Mending, there was attack. We saw something in Puch, there was a facility there. So there are things that we have seen directly, but the reported number from UN was 8. That press release they released, I think, last week.
Yeah.
You have your own list of all of these
One
attacks
facility
which we
that
didn't
we are,
access?
Because there is also the question is not only the facilities that were attacked directly, but there is also facilities that are forced to close down because the staff Because of insecurity, they fled with the population. So you have a population in the, and then there are facilities that are actually targeted. So
we can provide you the precise locations and the names of the locations. Okay. Any more?
Sorry, unless anybody else.
No, go ahead.
Where's the best place to illustrate the impact of those cuts that you were discussing? Would that be brink?
I think brink is a good example where you have like multi-sector cuts happening at the same time, like for one, like a displaced population. But I think the hard thing in South Sudan is it's happening across the country at all levels, because so it's hard to just highlight on one particular location, because what's happening is in all of the areas we work, we see a reduction. So that's, I think, what makes it hard to kind of fully assess the full impact, because it's happening across the board at every level, from primary healthcare, secondary healthcare. I think Renke is a good example because you have a high population crossing from Sudan, and at a time, where you've had a reduction in kind of services for people arriving. And then also in conflict affected areas, I think it's you have the funding cut. So say, for example, Ulang, even before the funding, the fighting happened and insecurity happened, like vaccination services stopped because of the funding. So you had that, now you have the insecurity, now you have the access. So I think it's in conflict affected areas, you have both the combination of funding cuts plus insecurity and the access constraints. And then in other areas of the country, which are maybe less affected by insecurity, you're seeing this reduction in basic services.
Thank you, Helen. If there are no more questions, I think we can close. I don't know if there are any final words from you.
Sorry, I'm Sam from MSF-supported. Just to add a bit more detail on the funding cuts. It's not just obviously the USAID funding cuts are very significant, but there's plenty of other governments, including the UK government, the government of the Netherlands, ECHO, who've also significantly reduced their funding, which is compounding the impact of the USAID funding cuts. But it's not just about the USAID funding cuts, it's cuts across the board for the humanitarian and development sector for different reasons. And similarly, just to reiterate, we don't not take money from the MSF, doesn't take money from the US government, doesn't take money from any governments. All of our funding, 98% of it comes from private individuals. But it's important to emphasise that we have in no way the capacity to meet the gaps that are going to be there, just to add a bit more detail on that. Thank you.
Well, this is for a country that has been heavily reliant on humanitarian aid. I think that the figure that the government promised was 15% of the GDP for health, but I think they have only contributed 1.3 to 2% for the last couple of years. The country has been reliant on aid largely over the years.
So just to add more to answer your question, yes, geographically it cuts across all the South Sudan, and in terms of medical thematics, it also cuts across all the medical scope. So we're talking about impacts on vaccinations. We talk about impact of on surveillance activities. So in the near future, we may expect also many of the outbreaks will go undetected because of the cuts, especially on supporting the surveillance systems. We're talking about cuts to the therapeutic feeding. So some of the NGOs had to shut down their activities because they don't have either the funding for staffing or to get the therapeutic food. Also, some organizations were focusing more on treating moderate acute malnutrition. So all this is gone now. Most of these kids will come to our hospitals with severe acute malnutrition in a late stage as well. Another important area, South Sudan has been classified as a moderate or not so high in HIV indicators, prevalence, but with the lack of ARVs, the treatment of HIV, many patients, unfortunately, will come in the future with advanced HIV cases, for example. So all these are things that might happen in the near future, and we need really to pay attention to that. As Helen said as well, some organizations had to reduce their activities in surgical care. Especially now we are talking about active war. So trauma cases and trauma management is very important. and there's civil lack in this area as well.
I have a question, which is about Gambela. You mentioned, Bakri, that there have been big displacement from South Sudan. So the question is, what is the situation in Gambela with new refugees still pouring in the region? Do you have any updates? So if you have any updates, but we also have Sabrina who follows Ethiopia, so we can also take some input from her.
Yeah, sure.
Sabrina, the question is, because there's a big influx of South Sudanese entering Ethiopia. So what's the situation on the other side of the border? So, by the way, Sabrina follows South Sudan and Ethiopia both.
And Nigeria. So for Ethiopia, yes, we have a team in Burube, which is what we mentioned. It is just the other side.
Move the mic, sorry.
Yeah.
Right, is on this.
This one.
So yeah, we have a team in Burube, which Bakri mentioned. It is just the other side of South Sudan Burube. There is an Ethiopian Burube. We are responding to a cholera outbreak for quite some time, since January, February, which was also due to the displacement which we saw in Ulang, in Nasser. But we also started receiving war wounded and a lot of displaced people. But there is approximately 15 to 30,000 people in Burube. And they are in not a formal settlement. Our team is doing primary healthcare services. In last 2 days, we also saw that the SSPDF took the other side of Burube. So population are moving from where we saw the settlement. Since yesterday, people are moving. We don't know where they are going. We don't know what are the health services will be available for them. We know there is a space identified to them, but there is no clarity how this population will be served. But yes, we are doing primary health care and also still responding to cholera.
Thank you very much, sir.
Just to highlight one thing, I think one element of complexity of this conflict of South Sudan, it has links to what's going on in the region as well. So the population dynamics, the conflict dynamics itself add another layer of complexity. So MSF works in Sudan, we work in Ethiopia, and now in South, and of course in South Sudan. And we try as much as possible to align ourselves in the management of patients and trying to understand the population movement, the population dynamics, and also the conflict dynamic in order to anticipate where we should be and where the crisis might happen. So, for example, now in Brink County, where we have significant number of Sudanese refugees and South Sudanese returnees, we see also the impact of the conflict in Blue Nile state of Sudan and the impact on Brink County as well. So this adds really another layer of complexity to our work and what we. So we're trying really to juggle all these elements together while we are trying to respond to the population needs.
Yeah, so I just wanted to complete what Bakr was saying about the region. So there are also people that we discussed about the Jonglei state and Upper Nile, but there's also Central Equatoria. And there you had also violence going on, attacks, displacement of population. There are teams of MSF in the border with Uganda. So we don't at the moment see like I'm not sure about the number of people crossing to Uganda, but it's also one of the areas affected is the Central Equatoria. We see displacement of people arriving in the camps in Juba. There are informal camps in Juba where MSF is operating, and we had already around 10,000 people displaced by the violence happening in Central Equatoria, and more going to Marobo as well, Marobo County. So just to say that it's we discussed Upper Nile and Jonglei, but there's also Central Equatoria where the violence is affecting.
I have a couple of questions online, and they are mostly from the Kenyan media, saying that what is the current situation of South Sudanese refugees seeking asylum in Kenya, and are we expecting a fresh influx? And then continued, given Kenya's role as the key player in regional peace efforts, what support does MSF expect from the Kenyan government or the East African community in responding to the community fallout? And do we have examples of South Sudanese patients of health workers with connections to Kenya whose stories highlight the human toll of this conflict? I don't know, Bakri, if you want to take it, the role, the regional aspect of Kenya.
MSF has been working in Kenya for quite a long time in different parts of the country, mainly responding to health issues within the Kenyan counties. However, we also work in some of the refugee camps in the border with Somalia, and we have very significant activities there. We don't work exclusively for the South Sudanese refugees here in Kenya for different reasons. But our primary focus in Kenya is to respond to many of the issues here in Kenya, whether it's in Homa Bay, whether it's in Mombasa, whether it's in Nairobi here in the some of the the informal settlements. We work also with specific communities like the youth, like the HIV community as well, in addition to the maternal health that we provide in different places, also including the refugees in Dadaab area, mainly from Somalia. So we don't work exclusively with the South Sudanese refugees here in Kenya. But we understand very well that Kenya is a major political power in the region. It has its importance in the region. And I think the message that we would like to send, not only to Kenya, but all the active actors in the conflict in South Sudan, is that the crisis is yet to be fully understood. The impact of the crisis is yet to fully understood. And what we need is to ensure the safety of the humanitarian workers, the safety of healthcare facilities, and the safety of the patients. This is a very important message. We will be very happy that whoever can send this message to the different concerning party in South Sudan will be very happy if this message is sent. Thank you.
We're almost end of the time, but there was a question about the Kenyan involved in the work in South Sudan, and we have Zakaria, who is Kenyan himself. So if you want to share how our teams are, but if you want to add something. The question is about Kenyans involved in the humanitarian activities. And generally, if you want to add a few words on the general context.
Okay. Yeah, so as we have already mentioned, South Sudan has been suffering a chronic shortage of terms of humanitarian staff in the health sector, but also in other sectors, and it's very underdeveloped in terms of movement, transport, and so on. So I'm working in South Sudan. I'm the head of mission for MSF. And I'm happy to be part of the teams which are contributing to implementing MSF activities. We have many other nationalities. It's not only the Kenyans. We have a significant number of Kenyans working in South Sudan in various sectors, but also we have other nationalities, internationally mobile staff coming from Europe, from other parts of Africa, in Zimbabwe, in Uganda. We are all there, and we're working together to alleviate the suffering, to intervene in this conflict and providing healthcare. Our main focus has been in Malaka and in Upper Nile generally, in Ulang, and we have seen firsthand what the violence has done to the communities, what the violence is doing to the patients who stay in the bush for 2 weeks because they are not able to get transport to reach the hospital in Ulang. And they are arriving in Ulang when they are already infected, or the patients who had burns and they were staying in the bush for several days. And when they arrive, the situation, they are really, the medical condition has really advanced. And unfortunately, we had to lose some of them. We are seeing currently an increase in number of displaced people coming to Malakal in Upper Nile. And they are all now, we are experiencing crowding in our health facilities. So they are arriving in Malakal, now the town is full of people, plus the protection of civilian camp, where we have internally displaced people, the numbers have gone up. And now we are seeing a high number of patients So the capacity is getting overstretched. And as we are entering in the rain season, when we will have more malaria, and we have seen cholera now, numbers are also starting to increase. So we are yet to see the worst. And it is unfortunate for the population we are serving, because with what our colleagues have mentioned, we are really going to be overstretched with the increase in malaria, with the number of cholera cases going up. We are seeing many neonates or children who are born, and now we are admitting a high number of children born because we have many pregnant women arriving in Malgal. They have been displaced from Old Fanga, they have been displaced from Akoka and from areas like in Ulang. So the humanitarian situation is very bad, and we are seeing it firsthand. And it is very concerning for us and for our staff and for the communities which we are serving.
Thank you very much, Zakaria. Go ahead, and then I'll last question, because please go ahead.
This one, my name is Lee. Okay. So I heard him mentioning Harvey County as one of the counties that you work with. Probably highlight some of the areas where you have come in, because right now we have people already moving from their areas into the flood that are already happening in Harvey County.
Okay.
Could you repeat the question out loud, please, for all the others?
Thank you.
Yeah, I heard him mentioning Harvey County as one of the counties that.
Which county, sorry?
You mentioned Harvey County.
Here, you mean in Kenya?
Yes, right here in Kenya. So probably highlight on that, because I report for a local station, and maybe they would like to know.
We mentioned Homa Bay during as one of the activities that we do in Kenya here. We haven't given any details about what's going on and what's happening there, because we are mainly focusing on South Sudan. But that was in a response to a question about whether or not MSF responding to the South Sudanese refugees here in Kenya or not.
But I think we can.
Yeah, we can talk about that definitely later, about what we do in Homa Bay.
And then
Yes.
Right, more.
Yeah.
Last question is maybe Helen, you can answer it. What specific health risks are women and girls facing in conflict areas, and how is MSF addressing sexual and gender-based violence in the crisis?
Yeah. So I mean, there's long-standing vulnerabilities now for women and girls in South Sudan. Like we already touched on it, like long-standing access issues for antenatal care, maternal care. In terms of like malaria, pneumonia, diarrhea, and children are still the three biggest killers in South Sudan, which require a basic, functioning primary healthcare service. In terms of violence, in all of MSF facilities, we treat survivors of violence, including sexual violence. And one of our concerns is also the massive displacement that this conflict is triggering, which we know heightens the risk of sexual violence and other forms of violence. So it remains, a very relevant intervention for MSF, but also a concern.
I would add mental health. It's a very important aspect during the wartime, especially on women and children. Just to give you an example, in the last week only, we had around 16 suicidal attempts in the protection of civilian camp in Malakal. That shows the impact and the toll of this war on the population. Some of them were really women. We had one child, I think, under age of 18. The others are youth, they are young people. So it shows the impact of this conflict on the mental health of the people.
Yeah, thank you very much, Bakri. On this note, I would like to close, but we are still around if you want to speak with any of our team members, any of the spokesperson. We're still around for the next 20-30 minutes. Happy to answer any of your questions. I would like to really thank all three of you, and I would like to thank all of you for showing up and to show interest in this context. Very important. Thank you very much. And we are around, and we will.
Thank you guys. Thank you.